Hello, my name is Dr. Lauren Dixon. I'm a GP in the Morecambe Bay area working with Better Care Together. Today I'm going to talk to you about coughs, colds and breathing problems in children. Coughs, colds and breathing problems in children are probably one of the most common presentations to family doctors around the country. It's really important to know that the majority of children will get better on their own without needing any medical help. You as parents are experts in your children and you are able to tell us when your child is unwell, and we rely on you to tell us that. It's really important when your child has a cough or cold to observe them and see if you think they're behaving normally. If you are worried, obviously we are here to help. When your child has a cough or cold, it's really important to observe how they are in themselves. If they're playing normally, eating normally, drinking normally, then the cough itself is nothing to worry about. If for babies this can be a little different. The reason for this is that babies rely heavily on their noses to breathe, and when they are blocked, they find it very difficult sometimes to feed from a bottle or to breastfeed. It's really important that the feeding continues, as we don't want them to become dehydrated, nor do we want them to become tired. Simple things you can try at home are, if your baby has a cold and is not feeding well, offer smaller and more frequent feeds. If your baby is taking less than half their usual feed over a 12-hour period, seek help. Repeated dry or damp nappies, dry lips or mouth, sunken eyes or fontanelle, that's the soft spot on the top of the baby's head, are signs of dehydration and you should seek help. Saline nose drops before feeds may help clear the mucus in the nose. These can be bought from your local pharmacist. Sometimes children with coughs and colds can present with breathing difficulties. This can be quite frightening as a parent to see, and it's important that you know what signs to look for and when to seek help. How would you know if your child is having difficulty breathing? This can often be difficult. It's really important to observe your child and to decide what you think is normal for them. Things you may see is that the child would be breathing quicker, the breathing may sound noisier or wheezy, and you may find that they are using extra muscles to breathe. What I mean by that is that when you're looking at them, you may find that they are bobbing their head. You may also find that they are using the muscles around their neck and also that they are sucking in around the rib cage. These are all signs that the child is having to work harder in order to create the same amount of breath as previous. And it's really important, if you see these signs, that you seek help from your local doctor. So just to recap, majority of children with coughs, colds and breathing difficulties will be fine at home on their own. It's really important for you as a parent to observe your own child and decide whether you feel they're unwell. If your child is eating, drinking, sleeping, playing normally but has a cough, then that is most likely to be a virus and will get better on its own. Observe your child closely. If you do see any signs that they are having breathing difficulties, it's important to seek help. Also observe their feeding, and if you are concerned, you can always get advice from your local pharmacist or your local GP surgery. Very rarely, children do present with life-threatening illness. If you see any of the signs we've mentioned earlier, it is important that you call 999. But please remember that most children will get better on their own, and all they need is lots of cuddles and a duvet day with their parents, and I'm sure that they'll be better in no time. When should you seek help? Coughs lasting more than 3 weeks, fast or short shallow breathing, noisy breathing, forced or strained breaths, chest and neck muscles pulled in with each breath, sucking in under the rib cage, raised temperature, less wet nappies, breathing making baby's head bob, breathing making nostrils widen, difficulty speaking or drinking, vomiting frequently after coughing, having less than half of usual feeds, pale or mottled skin, very restless or very agitated or very sleepy.